Hello everyone, myself Deepa Singh, working as assistant professor in Suresh Gandhi University. Today we discuss about factor affecting drug absorption. In this factor affecting drug absorption, mainly we covered patient-related factor or physico-chemical factor, how these factor affect absorption rate, or how some patient may vary effect of that particular drug. So let's start. In this, first we cover learning object. In learning object, before starting this topic, the student should be able to know about this effect of pharmaceutical and patient related factor. In means how some pharmaceutical factor, including machine or any other manufacturing process which are responsible in pharmaceutical industry, affect the absorption process or maybe affect particular formulation. And patient related factor, in previous lecture we already discussed about how some patient related factor like disease state, food contain, and some enzymes affect that particular patient or don't show desired effect of particular drug. Next is different type of excipients used in formulation. There's large number of excipients used in a formulation, and the selection of formulation excipients is mainly dependent on the type of formulation. According to different type of formulation, you select excipients, and before selecting or finalizing this excipient, you should assure that their compatibility or their interaction, they do not interact with each other or do not show incompatibility. If it is not if it's not incompatible, then it may be chances to get degrade or show some unstable product. So before starting formulation, you should assure all pre-formulation parameter. Next is granulation and other manufacturing technique. There's a different type of granulation techniques are available. So you know about which type of granulation technique is better for your formulation, or which type of granulation technique is available. And if this technique is not suitable, then you check another alternate technique, and how this granulation technique is also responsible to affect the absorption rate. So all these parameters, at least we know about this topic. Next is pharmaceutical factor. In pharmaceutical factor, first one is disintegration time. This time is mainly for tablet and capsule, because this tablet and capsule are in a solid dosage form and in larger particle size, and it gets break and converted to small particles. So this disintegration time is mainly calculated for solid dosage form or a tablet or capsule, because in liquid dosage form it's not possible. Liquid dosage form already in a solution form. So in this disintegration time, rapid disintegration is important to have a rapid absorption. So no longer disintegration time is required. If tablet having long or rapid disintegration, then absorption is also fast. But this is not good for all type of tablet. In some type of tablet, it should require less absorption or slow absorption rate. In case of slow release or sustained release tablet. And next is disintegration time of tablet is directly proportional to amount of binder and compression force. And this disintegration time or rate of this disintegration time is also dependent on the how much binder used or how much compression force is applied. Binder is excipient, which is mainly responsible to form the tablet or make the hardness of the tablet. So if you use large amount of binder, so it may be chances that tablet have a more disintegration time, or it don't easily disintegrate. But you use in maybe combination in a less amount, that it may be easily disintegrate, and also have compression force responsible for this disintegration time, because when you apply large force, your tablet may form more hard and it do not easily disintegrate. So increasing this disintegration time, you also should check proper compression force according to a tablet, which type of tablet you formulate, and type of tablet you select this compression force or the speed. Next, in this in vitro disintegration test for no means of guarantee of a drug viability, because if disintegrated drug particle do not dissolve, absorption is not possible. You just perform this test with the help of certain pH solution or buffer solution. In vitro test is possible for this disintegration, but you do not assure about the viability, because you're just performing in some machine or with the help of some machine, and in vitro test is done. So there's no guarantee about viability, how much drug is absorbed in your body after taking that particular tablet. So it do not assure or give 100% viability guarantee. Example, coated tablet, they have a long disintegration time. Fast dispersion tablet have a short disintegration time. We already say that you decide this disintegration time according to different type of tablets. Suppose you have a long disintegration time, then you coat your tablet or maybe use the more amount of binder. So it take more time to disintegrate. But in case of fast disintegration tablet, you should choose short disintegration time because you require fast effect or slow release or slow disintegration of particular tablet. So according to type of tablet, you should know or select this particular binder or the compression force, and so it should be properly way disintegrate, or it should have proper way to disintegration time. And this next is dissolution time. Dissolution is the process in which solid substance solubilized in a given solvent, that is mass transfer from the solid surface to the liquid phase. This dissolution is also for solid dosage form or mainly tablet and capsule, because after disintegration, dissolution takes place. Means after breaking into small particle, it distributed in particular solution or in a buffer solution when we perform in vitro test. But according to body, it may be distributed in your body with the help of blood circulation. And in dissolution time is also important factor which affect the drug absorption. It is a main factor which also responsible for affecting drug absorption, because this dissolution time helps to know about how much drug releases particular time. If you are preparing fast disintegrating time, fast release tablet, then you should have a less dissolution time and it easily dissolve. But in case of slow release or long period time release, we should prepare such type of tablet which should more time dissolution rate or more release in maybe longer period of a time. So this dissolution test is also possible in lab scale. You perform in vitro test with the help of dissolution apparatus. There's a different types of dissolution apparatuses available according to pharmacopoeia, like IP, UP, PP, and USP. These are some pharmacopoeial specific procedure which is available for dissolution test. And the next is manufacturing variable. Several manufacturing processes involved in the drug dissolution from solid dosage form. Example for tablet, it is the wet granulation and compression force. Manufacturing variable, not only single variable is responsible for this process. There are large number of variables, large number of factors that affect the absorption rate of particular drug. And this major effect is method of granulation, which method you use or which method you select for your formulation. If this method is not good for your formulation, in this case, this shows some error for absorption. And compression force means machine force or dice or punches force. If you apply more force, then maybe your tablet do not disintegrate or dissolve easily. So this is also select according to type of tablet. In this of granulation, there's different type of granulation method: dry granulation, wet granulation, and direct compression. Just difference between this dry and wet granulation is dry granulation do not contain any moisture or water content. You just take all the excipient and heat at particular temperature. Due to heat, it forms hard mass, and you just pass through C by according to the size of particle, and do not require any excipient, any water or humid contain, or directly transfer to your formulation or directly compress. Because in the dry granulation, you do not use any water containing material or any solvent, but in wet granulation, you should prepare a solution like star solution for binding all the excipient or preparing mass. And in direct compression, you just take all excipient and compress with the help of machine. So different type of granulation technique according to type of formulation. You maybe formulate fast disintegrating tablet or slow disintegrating, or maybe sustained release. According to this type, you select this granulation technique. And in this, the wet granulation process is most conventional technique, because in this wet granulation, there's moisture containing and easy to operate. But in wet granulation, there is some difficulty. If you just take all excipient and heat, and during heating, there is chances it get degrade or maybe decompose and do not the stable form. So this wet granulation method is the best method compared to all three methods, and the tablet that dissolve faster than the dose made by other granulation methods. And other type of technique is also good, but this type of technique is used according to type of dissolution you require. But in wet granulation, you have several limitations like formulation of crystal base or chemical degradation. But in wet granulation, there may be chances some crystal or chemical degradation is also takes place, because the contain water contain. But in this wet granulation, you should maintain that humid content or water content. After passing through sieve, you dry this granules with the help of oven. And during drying, you should know about how much moisture you should remove or how much dry it require. If your granules have some moisture, then it may be chances that it degrade your tablet or your formulation. If it have a no moisture or it too much dry, then in this case it also shows some problems. It will not easily compress. So you should maintain that particular humid or moisture in your granules during drying. And the method of direct compression force has utilized to yield the tablet that dissolve at faster rate. In direct compression tablet, mainly to prefer those formulation which require fast disintegration or rapid disintegration, because in this you do not form granules, you directly take all excipient and compress with the help of machine. And this type of tablet or direct compress tablet show fast disintegration or fast dissolution rate, because it dissolves easily as compared to dry granulation and wet granulation. Next in this manufacturing variable is compression force. In compression force, the compression force employed in a tablet processing influence density, porosity, hardness, disintegration time, dissolution rate of the tablet. Compression force is the force applied by machine between ties and punches. If you don't set proper machine, then it may be affect your formulation, do not have proper hardness. In this case, you should set the proper die and punches or size of the die and punches, and in this case it may be affect density, porosity and hardness, and disintegration time and dissolution time as well. As because you do not formulate good quality of tablet, then if it may have a certain hardness problem, it may be easily break, or during the transportation it gets break at a specific time period, or maybe some porous solution or pores are formed in the tablet, and dissolution and disintegration time is also affect. So you should properly set this compression time. Due to compression time, there are so many factors that affect your tablet, and a higher compression force increase the density, hardness of the tablet, decrease porosity, hence penetrability of the solvent in the tablet, and this slowing the dissolution and absorption. If you apply more force, it show more compression time or more hardness of the tablet, and it do not easily disintegrate and dissolve. And in this condition, you should use or formulate a slow release tablet, but you do not apply more compression force, and it should less hardness, so it easily disintegrate or break. This is a graph for some tablet and example. In this other hand, the higher compression force causes deformation, crushing and fracture of the particle into a small one, and causes a large increased effective surface area. The result is increase the dissolution rate of the tablet. When you apply compression force, or if this compression force is less, then it do not have a sufficient hardness, it easily break or fracture during the transportation, maybe during the storage condition. And this is also affect the surface area. And there's a graph in this A, B, C, D. There's a full formulation. A combination of both curves A and B is also possible as shown in figure C and D. A and B is showing decline, and B is also decline, and C is showing U-like curve, and D is just opposite to C. In this curve, you can see that B is increase or showing more dissolution rate of the tablet compared to A, B, and D. Next is pharmaceutical ingredient. There's different types of pharmaceutical ingredient are used for your formulation. Like more number of excipient in the dosage form, more complex. It is a greater to the potential absorption and viability problem. If you use more number of excipient or large number of, that it have a more absorption rate or showing large absorption, and viability problem is also decreased. But you should take a required amount of excipient. Don't use unnecessary more excipient. And commonly used excipient in a various forms are like vehicle. There are some major use excipients are also there. In this excipients, first is vehicle. Vehicle is the rate of absorption depending on its miscibility and biological fluid. This vehicle may be selected depending on the miscibility and biological fluid. And next is miscible vehicle was rapid absorption in this propylene glycol. This is an example of vehicle. And this is mainly you select according to miscibility or particular solution miscibility requirement. Next is immiscible vehicle. In immiscible vehicle, absorption depends on its partition from oil phase to aqueous body fluid. This immiscibility vehicle is mainly select in case of certain partition coefficient formulation and oil soluble or maybe water soluble, both type of nature of formulation according to type of formulation or according to route of administration beside this vehicle. It may be in a single or it may be in a combination. Not necessarily that is a single vehicle is present in formulation. There may be more than one type of vehicle is also present in particular formulation. Next is diluent. In diluent, there's a hydrophilic diluent is imparts the diluent retard the absorption. Means when you select hydrophilic nature diluent, it helps to absorption rate or shows more absorption, but you select a lipophilic vehicle or excipient like diluent, it retards the absorption, it will not show good quality of absorption, it shows slow diluent interaction forming insoluble complex and retard the absorption. Example, tetracycline DCP. If you use in a drug or diluent interaction type of excipient and it forms insoluble complex, and due to this insoluble complex, then the chances it retard the absorption. Example is tetracycline. Next is binder and granulating agent. In this binder and granulating agent, hydrophilic binder impart hydrophilic property to the granule surface, gives better dissolution property like starch, gelatin, KVP. Polyvinyl pyrrolidine is also binder, and this hydrophilic binder is mainly help for hydrophilic property of the granules or maybe help to water solubility of the granules. And the example of this hydrophilic binder is mainly starch, PVP, and starch is mainly used for large amount in your tablet. Next is more amount of binder, increase the hardness of the tablet, retard the absorption of the rate. If you use more amount of a binder, then maybe chance it show more hardness or do not have a good absorption rate, because more binder you use and tablet make more hard and do not easily break and show more hardness. Due to this more hardness, it do not absorb easily and showing some problems. Next is disintegrate, and disintegrate mostly hydrophilic in nature and decrease in amount of disintegrant significantly over the viability. This disintegrate are mostly in hydrophilic nature, but some of the disintegrate in hydrophobic in nature is also. And if you use this disintegrate, it easily break your tablet or your capsule, and decrease in amount of disintegrate affect the lower viability. Next is lubricant. In lubricant, commonly hydrophobic in nature. These lubricants are not oil soluble. This is a mainly hydrophobic in nature. This lubricants helps to improve the fluid property or interaction between the particles. They will inhibit the penetration from water into tablet. Next is suspending agent and viscosity agent. This suspending agent and viscosity agent is use both type of formulation, solid as well as liquid type of formulation. Stabilize the solid drug particle and thus affect the drug absorption. Macromolecule come from insoluble and absorbable complex with drug like sodium, CMC. Viscosity imparted act as mechanical barrier to diffuse of the drug from its dosage form and retard GI transit time. This suspending agent on viscosity agent is also affect your hardness of the tablet or your absorption rate. When you use large particle of drug or you use more viscosity or suspending agent, there may be less absorption or it may affect the absorption rate. So if you use more viscosity in part of mechanical barrier drug diffuse dosage form and retard GI transit drug. Next is surfactant. Surfactant are the most important excipient because this help to increase the solubility and enhance absorption rate also. And it may be affect directly to your formulation, may enhance or retard drug absorption interacting with drug and membrane or both. When you use this surfactant, it interacts with drug as well as membrane, or maybe both drug and as well as membrane also. Example, glycophyllin and steroids, and it may be decrease absorption but it forms the unabsorbable complex with drug above CMC. It is also affect absorption rate when you use more this surfactant or above CMC, there may be chances it retard absorption rate because at particular amount of surfactant is sufficient, but you use more amount of surfactant, it forms unabsorbable complex or the mask-like structure which is not easily absorbed, and this is occur mainly about the CMC, means critical micellar concentration, and it show less absorption or maybe no absorption. So you should use this surfactant according to required amount. Next is coating. This coating is necessary for tablet and not for all tablet. Mainly certain reasons is suppose bitter taste or require more release or larger period of time release. In this case, use coat your tablet. In this generally dosage effect of various coating on the drug dissolution from a tablet dosage from RS following model. Entry coated having a more absorption or release time, then sugar coated, then non-entry coated. Entry coated is mainly for intestinal effect. And in this dissolution profile of certain coating material change on aging, like shellac coated tablet, prolonged storage, dissolve more slowly in intestine. And this can, however, be prevented by incorporating liquid PVP in coating formulation. If a tablet having a coating or shellac-like coating material, so it should show prolonged release or more release and slowly release in your intestine, and it's a good tablet, but this type of shellac coating is required for controlled release or sustained release for long period of a time. Next is buffer. Buffer are sometimes useful in creating the right atmosphere for the drug dissolution, as was observed in buffer aspirin tablet. However, certain buffer system containing potassium, potassium inhibit the drug absorption as well as vitamin 2 and sulfonamide. When suppose your drug is proper buffer solution, but it do not have atmospheric condition is good, and is maybe showing certain problem. If you require tablet effect in your stomach, and this tablet is not prepared with according to stomach condition, like pH condition, and it release in your intestine. So this type of formulation do not show desired type of effect. However, certain buffer system containing potassium cation inhibit the drug absorption as seen with vitamin 2 and sulfonamide. Next is colorant. In colorant, this colorant is not necessary for all type of tablet. You do not use this colorant in all type of tablet according to certain requirement or maybe appearance to improve appearance of the tablet. You use this colorant, but this colorant should be FDA approved. Do not choose any type of color according to your wish. So you should take FDA approved or official colors, and the concentration is also fixed. And in this colorant, even a low concentration of a water soluble dye can have inhibiting effect on the dissolution rate. And this colorant is also affect the dissolution rate. If even you use a certain color in very small amount, then it may be alter or affect your dissolution rate and affect your or inhibit your dissolution rate. And the dye molecule get absorbed on the crystal faces and inhibit the drug dissolution. Example is brilliant blue retard dissolution of the sulfazole. This is a one colorant, brilliant blue. When you use this brilliant blue, it affects your dissolution rate. In sulfathazole tablet mainly, so you select according to type of formulation, or before selecting this color, you should assure that it do not affect your dissolution rate or your formulation, and you check pre-formulation study or the compatibility with particular formulation of with your drug. And next is complexing agent. In complex formulation has a use to alter the physico-chemical and pharmaceutical property of the drug. In this, enhanced dissolution through formation of the soluble complex, and enhanced dissolution through the formation of soluble complex. Example, glutamine, tartaric coffin, and complex of hydroquinone and digoxin. And these are the example. Means in complexing agent, you should prepare more than one excipient or select more than excipient, but it should not affect the physico-chemical property of the drug, biopharmaceutical property of the drug. This complexing agent mainly affect formulation or directly affected by pharmaceutical parameter, the viability or release mechanism. Enhanced dissolution through formation of the soluble complex. Example, glutamine, tartaric caffeine complex, and hydrogen digoxin is one of the example. When you combine these two type of excipient or two types of filter, it form complex and it show less solubility or show less viability. Next is enhanced lipophilicity for better membrane permeability like caffeine power complex. It is also affect membrane permeability or lipophilicity of the drug like caffeine and power complex. If there may be some chance of issue error or it will not show good formulation. In this case, you check all these ingredients or the complexity. In this, next is nature and type of dosage form it is to prepare and their nature. According to this, apart from a proper selection of the drug, clinical success often depend on the right. This means you know that which formulation is required and which formulation you select. According to type of formulation, there's these process may be vary. For example, solution may have a more fast effect because it's already in a solution form. It do not have a disintegration, dissolution, absorption because it directly reaches circulation and it may be do not break down in small particles. It's already in a solution form. Then emulsion have a less solubility compared to solution, then suspension, then capsules, then tablet. In this tablet, then coated tablet because it's already coated with certain type of polymer, so it do not get easily disintegrate. And next is entry coated tablet. This entry coated tablet is mainly for intestinal effect. This is also have less solubility compared to coated tablet. And the next is sustained release product. Sustained release product is also slow release product or tablet formulation, which release very slowly or particular time interval. This is all about nature and type of the dosage form. Next is this is a flow chart. In this flow chart, you should know about the influence of dosage form, appearance of the drug solution in GI tract, how it affects in GI tract. There's a dosage form in this aqueous solution. Aqueous solution, then in this precipitation takes place, and there's last is immediate release in solid dosage form. In this disintegration takes place. Not only in aqueous solution and suspension, there's precipitation, but in case of a solid dosage form, the disintegration takes place. After this, in solution and for suspension of the fine particle of drug in GI fluid, it directly goes in the GI fluid because it's already in a solution form. There's no need to disintegrate or break down the fine particle. And after disintegration, it aggregate or form the granules. This is mainly for your immediate dosage form or solid dosage form. Then dissolution is takes place. Dissolution is for both type of formulation, solid as well as liquid formulation. Then solution of drug in GI fluid, and then absorption. And after absorption, your drug goes in your blood, and with the help of blood, it reaches to systemic circulation for particular site for showing the desired effect. And this is how your absorption or effect of drug produced at particular site. Next is product age and storage condition. In product stage and storage condition mainly determined with the help of certain stability study. According to stability study, you should decide the expiry date or their particular storage condition time, how much long do you use that particular formulation. In this product, aging and the storage condition can be adversely affect the viability by change its specialty in physico-chemical property of the dosage form, like precipitation of a drug in the solution, hardening of the tablet, change in particle size of the suspension. When you put a properly good formulation and it comes in the market, but you store this tablet and during storage or during using this formulation, it will maybe degrade or show certain problems like many precipitation of drug in solution. This takes place, you're using syrup, and in the syrup there's a precipitation you see during using. So it is not good sign, and it may be say that it may be degrade before time. And hardening of tablets, because you're preparing fast disintegrating tablet, but during the storage it forms too much hard tablet and it will not easily disintegrate, and showing slow release tablet instead of fast disintegrating tablet. Next is change in particle size of the suspension. During the storage, there may be chance the particle size get aggregate or form the mass, and due to the large particle of size, it do not show good effect or fast effect. So this is also may occur during the storage condition. These are the different types of route of administration. You should know this route. In this parental route is mainly they avoid. You know that parental route are means you apply with the help of certain injection. In this maybe intramuscular, intravenous, subcutaneous, or intradermal. All these are the parental route. Other than this, like subcutaneous or intrathecal route is also there. First is intra-arterial. In intra-arterial injection is used to deliver the drug directly to the organ. For the example, in cancer, chemotherapy used for vasopressin or GI bleeding. Then this intra-arterial use this injection for mainly chemotherapy or cancer therapy, and you apply this injection directly to the artery. Next is intrathecal. In this injection directly in the cerebral brain and assure complete CNS viability of the drug that cannot be crossed the blood-brain barrier. And in this, you apply on a CSF or cerebrospinal fluid and check the viability in CNS, but you do not cross the blood-brain barrier. And example is mebufotenin and pilocarpine spinal anesthesia. And next is intravenous. In this intravenous administration introduced directly in the venous circulation, IV bolus is used for immediate therapeutic effect, typically for general anesthesia and treatment of cardiac arrhythmia. This intravenous is used mainly for a certain type of formulation like anesthesia or cardiac arrhythmia or certain attack during the emergency situation, because this intravenous is a more fastest route, not only for parenteral but other than solid, liquid, all type of dosage form, because you give this type of formulation directly in the vein, and with the help of this intravenous administration it should directly affect to particular site and it is the fastest route for therapeutic effect. Next is intramuscular. Intramuscular injection is used mainly for drug with vaccine that are not absorbed orally. For example, aminoglycogen, insulin, hepatitis vaccine, and intramuscular route is often used for sustained medication and specialized vehicles such as active solution and oily vehicle. This intramuscular route is mainly used for those type of formulation or those vaccines which are in oil solution or not absorbed by oral route. So use this intramuscular injection, and this is mainly for vaccine type of formulation, and you use oily solution as a suspension also for this intramuscular route. Next is topical route. This is just opposite to parenteral route. You just apply or you prepare semi-solid dosage form or liquid dosage form for this topical route. In this first is transdermal. In this drug delivery route include continuous release of the drug over a specified period, low pre-systemic clearance and facile tract withdrawal is simple removing the device and good patient convenience and compliance. This transdermal is good because everyone apply or everyone use this route, because in this transdermal route you just take a formulation, apply at particular site, and with the help of formulation it cross your membrane. And in this transdermal patient, no trained person is required, but in parental there is a trained person is required which give you injection, but in transdermal it is a more convenient and good for patient also. In this, some disadvantages relate to varied property of the skin and skin reaction and relatively large dose size. Generally, small doses delivered like less than 10 mg. Example is alglucoridine and estradiol. Next is intranasal. Intranasal is mainly for nasal formulation, or maybe you apply your formulation with the help of nasal route. Intranasal administration may be used for local and systemic effect. Local effect include treatment of nasal allergies, rhinitis, and nasal congestion. Nasal delivery for systemic effect is established for a small number of the drug. This nasal drug having a less number of formulation. It do not have large number of formulation, and very less number of drug is delivered by nasal route, and with the help of this nasal route you apply your formulation or right reaches the formulation to localize at a systemic effect. Means this is not only for nasal problem, but it is a systemic problem is also solved with the help of this nasal route, and this is mainly used for nasal allergitis, rhinitis, and nasal congestion. And in this, next is vaginal. Vaginal drug is only used for more local effect, but vaginal absorption can utilize more and efficient systemic delivery. Example, vaginal ring biodegradable microsphere. This is only also used for the large time effect or control release type effect. And in this vaginal, their absorption is also fast and rapid efficacy that is observed. Example, in this mainly some rings of biodegradable microsphere is used. Next is antennal route. In the antennal route, rectal absorption is generally slower than oral absorption, and but some drug rectal absorption exceed oral absorption presently due to avoidance of first-pass metabolism and affect rectal delivery. This rectal route is also good, and it's more efficacy compared to oral route, because in this rectal route there's first-pass metabolism is not done or don't take place, but It shows good efficacy or more absorption in tightly reaches near circulation or by the help of rectal route. In this example is metoclopramide and ergotamine and lidocaine. Next is buccal. In buccal, drug can be absorbed from the oral cavity itself or sublingually. And absorption from either route is rapid and sublingual more rapidly because greater permeability of sublingual membrane and reach the blood supply. The pH of the saliva is approximately 6, so that the drug absorption predominantly passive in nature and favor for unchanged molecule acid with pK value less than 3 and base with pK value less than 9. And this is mainly buccal route for those type of formulation which require for emergency use or during the emergency because it show fast effect. In this buccal route, you use your formulation by sublingual route, and with the help of this sublingual route, the drug is directly reaches to blood circulation and show more fast effect or desired effect, or you can say that it show more effect. In this case, less formulation dose or concentration is required. In this, there's a different pK value according to type of formulation. For acid, there's a pK value is more than 3, and for base, should be less than 9. Example of this buccal route is organic nitrate, barbiturate, papaverine, pyrazine, and benzodiazepine. All these are the drugs which is used for or by the buccal route during emergency situation or maybe normal situation. And the cell membrane consists of globular protein embodied in turmeric, fluid lipid bilayer matrix, and cell membrane are generally thin, approximately 70 to 100 angstrom in thickness. These phospholipid bilayer is play important role in your buccal route, and it is mainly for hydrophilic as well as hydrophobic both type of molecule, and it have a head like hydrophilic and hydrophobic tail. Due to this both type of nature, it should good penetration or good permeability, and lipid soluble drug tends to penetrate cell membrane more easily than polar molecule, and protein provide a pathway for the selective transfer of a certain polar molecule and change ion to lipid barrier. Next, in this, we start patient-related factor. In patient-related factor, first is age. In age, in fact, the gastric pH is high, and intestinal surface and blood flow to GI flow resulting in blood absorption and patterns in compared to adult. And elderly person gastric emptying ultra decrease intestinal surface area, GI blood flow, higher incidence of hyperglycemia impairing drug absorption means age is also responsible for absorption of the drug. If you can see that in children, it show more absorption because they do not have completely developed structure, and in case of the old age patient, it also may affect the absorption rate according to thickness of the membrane. So according to age, this absorption rate is also vary. Next is gastric emptying time, the process by which drug leaves the stomach and enters the duodenum. And in this gastric emptying is required when the drug is passed away from this to part of the small intestine. Means this gastric emptying time is also responsible for the absorption rate, and if the gastric emptying time is not good, then maybe it will show absorption problem. And this gastric emptying is mainly takes place in this part of the small intestine, and this gastric emptying time is very person to person. And delayed gastric emptying is required when the drug are absorbed from proximal part of the small intestine, prolong the drug absorption site contact desire. And gastric emptying is the first order process. In this gastric emptying, there is a rapid, there's a speed at which stomach content emptying in the intestine. And gastric emptying time is the time required for gastric content of the small intestine. And gastric emptying half-life is the time taken to half of the stomach content to empty. And these are the three terms that you, at least you know about this term. First is gastric emptying time, and this stomach content empty in the stomach. Your stomach content is empty in the intestine, and means your stomach get empty, and this content is goes in the intestine. Is the gastric emptying time, and gastric emptying time is required. How much time you take, or how much time is required to transfer the content from stomach to intestine is in gastric emptying time, but in rate means how much content, how much amount is transferred from the stomach to intestine. But in gastric emptying, half life means the half time taken to stomach content to empty to the intestine. This is the volume of ingested material as per the increase or decrease amount or bulky material tends to empty more slowly than liquid. In this type of meal, gastric emptying rate in this carbohydrate is more than protein than fat. The physical state of gastric contain solution suspension of a small particle emptying more rapidly than chunks of material that must be reduced size prior to emptying. Body portion line on the left side decrease the emptying rate and right side promote it. And drug reduction in this anticholinergic reduction in rate of emptying, and narcotic analgesic reduction in rate of emptying also. Ethanol is also same for reduction in rate emptying. Emotional state in this anxiety promote depression, retard it, and it shows less absorption. Disease state gastric ulcer, hypothyroidism retards it, and duodenal ulcer, hyperthyroidism promote it. Next is interstitial transit time. In this interstitial transit time, it's a major site of the absorption of the host drug. Mixing movement of intestine can offer the peristaltic concentration and promote the drug absorption firstly by increasing the drug interstitial membrane content as secondary, enhancing the drug dissolution, especially for poorly soluble drug, although induce agitation. And delay in interstitial transit is desired for drug that dissolve or release slowly from dosage form, like sustained this formulation drug that dissolve only in intestine, like entry-coated tablet, and drug absorbed from specific site in the intestine is several B vitamins. Means according to formulation, your interstitial transit time may be vary, like maybe vitamin B. If there is a specific side effect or entry-coated tablet, it should resolve problem or maybe sustained release, which will be slow and dissolve slow. This is the transit time in duodenum 5 minutes, jejunum 2 hours, ileum is 3 to 6 hours, protein is 0.5 to 1 hour, colon is 6 to 12 hours. Interstitial transit time influence of various factors such as food, disease, and drug, and metoclopramide, which promote the interstitial transit, enhance the absorption of rapidly soluble drug, which anticholinergic retards interstitial transit and promote the absorption of poorly soluble drugs. Next is disease state. In this disease state, gastric disease acrolytic patient, they must have an adequate production of acid in the stomach. HCl is essential for solubilizing 3 bases, and many weak base drugs that cannot be water soluble zones remain undissolved, therefore dissolve and absorbed. Salt form of this drug may cannot be prepared because of it rapidly precipitate out, and dapsone, itaconazole, and ketoconazole are the example. When this disease state is also responsible to affect the absorption rate and retard the absorption rate. In this cardiovascular disease, patient change the associated with congestive cardiac failure influenced by ability of the drug, edema of intestine, decreased blood flow to the GI and the gastric emptying rate, and altered GI pH, secretion and microbial flora. Next is blood flow through GIT. It plays a major role in absorption of continuous maintain the concentration gradient across the epithelial cell, and the GI is extensively supplied of blood to capillary network. But blood flow is important for activity absorption of the drug. Absorption of a polar does not depend on the blood flow, but rapid soluble molecule high depend on the blood flow. Both influence blood flow to GI detoxification area after meal persist few hours, but absorption is not affected. And in this GIT contain, first is food drug interaction. The presence of food in GI tract can affect the ability of the drug. Digested food contain amino acid, fatty acids, and many nutrients that affect the interstitial pH and solubility of the drug. And some affect the pH and ability of the drug, like the ileum gastric emptying, stimulating mobile, change in pH tract, increase sphenic blood flow. And next thing, this patient of the food with affect absorption is following way: decrease absorption like penicillin, erythromycin, ethanol, tetracycline, levodopa. Increased absorption is observed in dissolution, diazepam, and vitamins. And in case of fluid, large fluid volume retard the better dissolution, and rapid gastric emptying enhance the absorption. Example of this fluid volume is erythromycin is the better absorbed when taken with glass of water under a fasting condition and when used with the meal. Next is interaction of the drug with normal GI constituents. In this, the GI constituent number of normal constituents such as mucin, which is protective, and mucopolysaccharide that binds the GI mucosa, interact with streptomycin. Next is pre-systemic metabolism. In this, loss of the drug through biotransformation by such eliminating organ during the passage of systemic circulation is known as first pass of pre-systemic metabolism. And complete absence of drug in after oral administration is indicative of the first pass effect. And the four preliminary system which affect the pre-systemic metabolism is luminal enzyme, withdrawal enzyme, and bacterial enzyme, and hepatic enzyme. These are the enzymes also affecting absorption rate. This luminal enzyme, the primary enzyme found in gastric juice is pepsin, lipase, amylase, protease secreted from the pancreas into small intestine in response to digestion of the food. And in pepsin, there's a protease are responsible for degradation of protein and peptides in the lumen. Next is gut wall enzyme. These are also called as mucosal enzyme. These are present in stomach, intestine, and colon. Also, the hydrogenase ADH is enzyme of stomach mucosa and activated ethanol. Sulfation of ethanol suprarenalin is example of gut wall enzyme. Next is bacterial enzyme, in this which are mainly localized within the colonic region of the GI tract, and secrete enzyme which is capable of the range of reaction. Sulfasalazine is a prodrug of this hepatic enzyme. In hepatic enzyme, several drugs undergo first pass hepatic metabolism. The highly extracted one having acetylcholine, propylene, and diazepam. These are the drugs which are mainly responsible for hepatic enzyme and affect the absorption rate. This is an example diagram of this hepatic enzyme. And after this, you should know about this topic completely. This is a learning outcome. Today we already covered all topics of factor affecting patient related and different enzyme. In this, you should know about different pharmaceutical and patient related factor affect absorption rate or responsible to alter the absorption process. Different type of enzyme affect the absorption. Route of administration, including parenteral as well as topical. Different type of excipient is used in formulation. And these are the references in these references. First is Brahmanka D.M. Jaiswal, SB first edition, absorption of drug by pharmaceutical and pharmacokinetic. It was developed Prakash Delhi 1995. Sahakal L. Edward BC fourth edition, physiological factor related to drug absorption applied by pharmaceutics and pharmacokinetic, Creative Hall International ICT in for 1999. Alton M. Pharmaceutics, the science of a dosage form design. Second edition, Churchill Livingstone. Fourth references Margaret G. Walling Jesse, Absorption Encyclopedia of Pharmaceutical Technology. Third edition, Marcel Decker, Ascension, New York, 1988. Page number is 1 to 32. Fifth reference is Biopharmaceutical and Pharmacokinetics by G.R. Chatwal. And sixth is Human Anatomy and Physiology by Todora. And this is all about reference. Now, questions. Question 1 is route of administration when passage of the drug through liver is minimized by oral route, based on dermal route, says rectal route, and these intraduodenal route. In second question, which route of the drug administration led to first pass effect is for oral route, intramuscular route, and sees rectal, then intraduodenal route. In third question, what is the characteristic of oral route as a fast onset of effect is first, and B is the absorption depend on GI tract secretion until then reaches directly. The sterilization of medical form of obligatory. And in fourth question, the features of the sublingual route is A is pretty fast absorption, a drug is exposed to gastric secretion, a drug is exposed to more permanent liver metabolism, a drug can be administered in variety of dosage. And fifth one, parenteral administration cannot be used with unconscious patient A. B is a general result in less accurate dosage from the oral administration. C is usually producing more rapid response than oral administration. D is too slow for emergency use. And in sixth question, what is the characteristics of intramuscular route of the drug administration? A is only water solution can be injected. B is only for solution can be injected. C is opportunity for hypertonic solution injected. Then D is enzyme inhibition based auto-induction, says product inhibition based auto-conduction. In time when the process in which some drugs remove their own metabolism is known as first enzyme inhibition based auto-induction, series product inhibition, and is auto-conduction. This is all about question. So thank you everyone for watching and listening to this video. Thank you so much.